contagious viral illness that in its most severe form causes paralysis, difficulty breathing, and sometimes death. The polio virus attacks the nervous system. This causes lack of muscular control, which can be anywhere in the body. In worst cases, it causes complete paralysis of the legs, arms, and even your diaphragm, which controls your breathing. Polio would be the Global Eradication Initiative. In 1988, the 41st World Health Assembly adopted a resolution for the worldwide eradication of polio. It marked the launch of the Global Polio Eradication Initiative, spearheaded by national governments WHO, Rotary International, the U.S. Centers for Disease Control and Prevention, the UNICEF, and supported by key partners including the Bill and Melinda Gates Foundation.
Elena Moore? We've got the results back for your polio test. And before I tell you if you tested positive or negative, let me tell you a little bit about what polio is. Okay, it's a highly contagious viral infection, and you can become paralyzed, and you can have breathing problems, and sometimes you can even die. Alright, about 95% of polio cases display no symptoms, but there is that small chance that it can lead to death and paralysis. And you tend to be vulnerable members of the society. You know, you were pregnant at the time, so that's why that you are a little bit more vulnerable for that. Some people, the lucky people with polio, they actually don't display symptoms. If they do appear, it's going to feel like you have the flu. Have you had any of those symptoms?
Yes.
You have? Have you been throwing up any or anything?
A few times.
You've had any muscle tenderness?
I'm having spasms on my right side.
Right. Well, the sad thing is there is no cure for polio. We have no treatments. All we can do is increase your comfort and manage the symptoms and prevent the complications. We can give you a lot of painkillers. We might even give you a ventilator. But there's not really anything we can do to keep you from getting worse or getting better.
So you're saying I had polio?
Well, not exactly. I'm just going to kind of tell you a little bit about it some more. There are 2 vaccines that you can take to prevent it. But once you have it, you know, those are they don't help. But we are going to tell you that you do have polio.
Doctors often recognize polio by symptoms such as neck and back stiffness, abnormal reflexes, and difficulty swallowing and breathing. To confirm the diagnosis, a sample of throat secretions or colorless fluid that surrounds your brain and spinal cord, known as cerebral spinal fluid or stool, is checked for the presence of polio virus.
So can you tell us a little bit about what it's like having polio? How do you feel?
I usually have a lot of headaches, and it's very painful for me. I usually run high fevers very occasionally. I lose my reflex ability, so I can't really I can't react to some stuff. My arms sometimes get kind of lazy, so I can't really move them well, especially on my right side. I can't really breathe that well. It kind of hurts my lungs to breathe very bad, and I can't see. I'm starting to lose vision, so I really can't see where you're at. And I can't really taste or swallow. And I've been told that I'm probably going to end up being paralyzed for the rest of my life.
Right. What do your symptoms feel like when you wake up in the morning? Throughout your day, how do you feel?
I can't really control my arms and legs. So
Can you show us what that looks like when you can't control your arms and legs?
So if I'm shaking your hand, I can't control it.
So it's just floppy?
Yes,
You can't
I don't have any muscles. And I just want to fall sometimes. You know, it's terrible. I have muscle spasms sometimes, and especially especially on my right side. It just really hurts. They're very, very painful, so the doctor, prescribed me painkillers because I have to use those on a daily basis because I'm in a lot of pain. My breathing is low, so I get on a ventilator every day. My sight is not that good, so I have a seeing dog. I can't taste or swallow food, so I don't really like eating anymore. And my worst fear is I'm not going to be able to provide for my family, and I constantly have to have somebody take care of me.
Right. How exactly did you get polio? Like, where do you think that this happened?
Well, a few years ago, I was 17 and I got pregnant, and I went on a mission trip to Uganda. I was unaware that the main victim for polio is very young and pregnant women, so I was very, very vulnerable at this time, and I did not know that. While on this trip, I was in contact with many polio patients, and I didn't know, and the virus was in their throat and intestines. So one day, a polio-infected patient sneezed on my hand, and I didn't think anything about it, and I forgot to wash my hands, and I went to lunch, and I was eating, which that's how it spread. It's through like the mouth and nose and eyes and stuff, and I started getting my symptoms about 2 weeks later.
Okay, well, thank you, Elena. We're going to try our best to make you as comfortable as possible.
With this disease, you need to know when to see a doctor. Be sure to check with your doctor for polio vaccination recommendations before traveling to a part of the world where polio may still occur naturally or where oral polio vaccinations are still used, such as Central and South America, Africa, and Asia.